Kia ora tātou katoa. Thank you very much, Di, for that excessively over-generous introduction, but it's very kind of you. And I'd like to congratulate Diana Safati and Chris Jackson and their colleagues for organising this meeting, which is so important. And also I'd like to thank, as I'm sure we all want to thank, our two previous speakers for their wonderful testimony, really, about things that are so deeply personal. Sir Richard Dole, who was my boss at Oxford for 7 years, used to recall how a professor of surgery had said to him that trying to prevent cancer was not only a waste of time, but also faintly immoral. Of course, people used to think of cancer as part of the normal process of ageing, and some people felt that it was certainly impossible to prevent it, and it was somehow interfering with nature, and so all the emphasis went on treatment. Even today, as you know, many people have a fatalistic, defeatist attitude to cancer, not only in regard to prevention, but also treatment. Recently, a friend told me that his wife had been diagnosed with a serious neurological disease. And I was terribly sorry to hear that. But at the end he said, "But David, it's not cancer." And I thought, well, actually, I'd rather have most forms of cancer than what she's got. So we still do have that fear of this bogey. In fact, as I'm sure everyone here knows, there's a huge amount that can be done to protect people from developing cancer and to treat effectively those who do develop the disease. And most people in this room will at some time in their life either develop cancer themselves or have a close loved one so affected, or both. The countries that have made the most progress in dealing with what our kaumātua called this taniwha are those that followed the advice of the World Health Organization and other bodies in implementing a national strategy for cancer control. So we've talked about cancer control a bit already tonight. It means a systematic and coordinated approach to prevention, early diagnosis and screening where that is beneficial, treatment that is timely and effective, rehabilitation and palliative care where that is necessary. Exactly 20 years ago, and Chris talked about maybe we'll have another meeting in 20 years, and funny enough, exactly 20 years ago, in 1999, I was involved in a big workshop here in Wellington at which over 100 invited participants discussed the development of a national cancer control strategy, and probably some other people here were present at that meeting as well. It was initiated by the Cancer Society in conjunction with other cancer NGOs and also with the Ministry of Health. It came about because the death rate from cancer in New Zealand was steadily increasing, and it was clear that we were not doing as well as other countries like Australia or Canada. The main keynote speaker at that meeting was Sir Ken Kalman from the United Kingdom. And interestingly, the United Kingdom was another country that in the late 1990s suddenly woke up to the fact that their cancer survival results were not as good as some of their European partners. Perhaps I shouldn't call them European partners anymore, because sadly that seems to be falling apart. In a moment, I'm going to talk about the steps that were taken after that workshop. But first of all, I'd like to review what's actually happened to the cancer mortality experience that precipitated it. There's good news and there's bad news. The good news is that by 2015, the death rate from all cancers combined, which had been rising, had fallen by 19%. Now, that was not as big as the reduction in mortality from heart disease, which was actually by 47%. It's remarkable, nearly halved in 16 years. But it was certainly a welcome change. The falling death rate was due to both better prevention such as smoking control, and better treatment, such as chemotherapy for breast cancer. But although the cancer mortality rate has decreased, our growing population, of course, and its evolving age structure means that the numbers of new cases and deaths from cancer are rising substantially. So by 2015, there were an extra 6,000 new cases of cancer each year in the country, as well as an extra 2,000 cancer deaths every year. So if we don't plan quickly and effectively, our oncology services are going to be swamped. And people like Chris Jackson and the other oncologists here are going to be exhausted and run off their feet. The other bad news is that our death rate from cancer, the risk to you and me after adjusting for age, is above the average for the OECD. It's considerably higher than in Australia or France or Portugal, let alone Sweden or Switzerland. In 2002, a colleague and I published an analysis that showed that each year over 800 New Zealanders die from cancer who would not die if the Australian rates applied here. A dozen years later, an Auckland group has repeated this exercise and found a very similar picture. The mortality rate had declined in both countries, but there were still nearly 800 New Zealanders, 200 men and 600 women dying from cancer each year who would not die if we had the Australian rates. There is a bigger difference in deaths than in the incidence of cases, which indicates that patient survival is lower in New Zealand. And the data suggests that issues of early management in primary care and delays in diagnosis and starting treatment may be the most important factors. So the media always focus on the availability or non-availability of expensive drugs like Herceptin and so on, and they may be very important, but actually the most important factors are sort of rather boring humdrum issues about the performance of the health system and those delays that stop people getting from their first consultation to the hospital, having the necessary tests and treatment started. Well, I've mentioned lots of numbers, but Bradford Hill, who was perhaps the most respected medical statistician of the 20th century, used to say that statistics are just people with the tears wiped off. People with the tears wiped off. So this is important. And why are we not doing better? Well, I think the first reason is complacency. We have some of the highest rates of bowel cancer in the world. Indeed, New Zealand women probably have the highest female incidence of colorectal cancer. So why are we still, in 2019, still bumbling along with the gradual rollout of a screening program when countries like England and Australia started their national programs, not pilot studies, national programs 13 years ago? The good old Kiwi complacency is evident in the media as well as the health bureaucracy. Late last year, there were headlines in several newspapers and on radio saying that the Kiwi melanoma rate may be dropping. Well, you've heard about melanoma tonight, and I worked on melanoma in the 1980s, and we could see this evolving epidemic in each generation of New Zealanders. So I was very intrigued by these headlines. But when I looked into it, it came from an Australian speaker at a conference who said very cautiously that unpublished data seem to show that New Zealanders in their 20s and 30s have lower rates than their parents' generation had at the same ages. The newspaper reports did not highlight that the speaker mainly talked about what he called New Zealand's grim melanoma statistics, the fact that we've leapfrogged Australia and now have the highest melanoma rates in the world, and that the number of people dying from melanoma is continuing to increase. So it's odd, isn't it, that we always want to hear the good news rather than facing up to the challenges. Apart from complacency, the other key problem, I believe, is a lack of leadership. So now I'll come back to briefly talk about what happened after that workshop 20 years ago. The Minister of Health at the time, who was Annette King, realised that responsibility for cancer control could not just be left to the Ministry of Health. There needed to be a national plan forged by collaboration involving not just the ministry, but also NGOs, health professionals, and academics. A New Zealand Cancer Control Trust, funded by the Cancer Society and the Child Cancer Foundation, joined the ministry in producing a New Zealand Cancer Control Strategy, which was published in 2003. And I'd like to acknowledge the great work that was done by those involved in the trust, including Professor John Gavin, Betsy Marshall, and Brian Cox. The Cancer Control Strategy was an excellent document. You can find it on the Ministry of Health website, and it still, I think, has a lot to contribute. And it was followed by a 5-year action plan. There were some real achievements, there was some real momentum in those early years, and we saw progress in smoking control, and women with breast cancer didn't have to keep flying to Australia for radiotherapy, as some people may remember was all too common. But sadly, then everything petered out. The Minister appointed a Cancer Control Council chaired by Dame Catherine Tizard, and later its name was changed in the way we keep doing in New Zealand to Cancer Control New Zealand for some reason. But if you haven't heard from them lately, it's because this independent ministerial advisory committee was disestablished in 2015. The NGOs had already been shut out of the process, with the New Zealand Cancer Control Trust being wound up some years ago. According to the Ministry's website, Cancer Control New Zealand was abolished, and I quote, because its role was superseded by the progress made in improving cancer services for New Zealanders. Well, that would be hilarious if it wasn't so sad. Meanwhile, the Ministry had produced largely on its own a New Zealand Cancer Plan 2015 to 2018. This reads like a public relations document. It's also on the web, and I'd challenge you to look at it sometime and to compare it with those rigorous documents that were produced more than a decade ago. It just makes me squirm. It almost makes me weep to read it. It's all about how lucky we are, how wonderful things are, what a wonderful government we've got, with a Minister of Health, who, by the way, was a doctor at the time, not an Otago graduate though. And it's just is so sad to have what should be confronting where the challenges are, coming up with some plans which can do something about them, but instead it's just public relations. And the contrast between the documents shows you what a fix we're in. The Ministry's investment in the so-called better, faster cancer care was criticised by the Auditor General for not being monitored and involving complicated and ambiguous definitions which made measurements unreliable. Data monitoring is vital for cancer control, and it's great to see that a colleague from Canada will be speaking about performance measurement on Friday. As a matter of fact, on several occasions over the last 20 years, experts from, I think it's called the Canadian Partnership Against Cancer, have been here and given valuable advice on performance measurement. But so far, it has been unheeded. So let's hope that they listen this week. I can't emphasise strongly enough that if cancer control is just left to the ministry and district health boards, which has been the situation in recent years, it will fail to reach its potential. Of course, the ministry has a crucial leadership role to play, but we need a coordinated effort involving health professionals, consumer representatives, and non-governmental organisations. And remember that NGOs already invest significant amounts in primary prevention, palliative care, patient and family support, treatment, and research, which is also essential. And wouldn't it be great if all those activities were coordinated, if we were working together to get the best results that we can? Things look more hopeful when the Labour Party manifesto for our recent election promised that a national cancer agency will be established. And according to the manifesto, and I quote, "The agency will oversee prevention, detection, treatment of cancer, and improving outcomes for survivors. It will develop a national cancer plan and develop targets to reduce death rates." There was even specification of how many $1 million would be allocated to establish the National Cancer Agency. Well, we have a Labour-led government, so why is nothing happening? I expect we'd be told that this proposal did not survive the coalition negotiations. That's the usual answer. Well, if that's the case, I think New Zealanders should be asking, was it the New Zealand First Party or the Green Party that opposed doing something about New Zealand's mediocre cancer performance? Cancer is the leading cause of premature death in New Zealand. And of course, quite apart from death, it causes so much suffering and anguish for so many of our families. The burden of cancer on the health system is rapidly increasing. We expect our sports people, like Mike Hesson, to excel. The All Blacks aren't supposed to come 20th at the World Cup. So why are we willing to accept healthcare that is clearly inferior to what we can afford as a country? I hope that New Zealanders will start to demand that we face the challenge of cancer squarely and develop a coordinated plan for dealing with it more successfully. Kia ora tātou.